So you have your NBCOT study plan set, but how exactly do you go about answering questions? Today I'm going to share with you a step-by-step way to read and answer every single question on the exam.
Take 450.
My name's Jordan. I am a registered occupational therapist, and I'm here to help you pass your boards exam. Before we get started, a quick reminder for you to hit that red subscribe button and the notification bell so that you never miss a video of mine. Okay, so last little thing, I have to give credit to Pass the OT. I'm gonna put a link for their channel down below. Go ahead and pop over to their channel when you're finished here because they have some really great videos about breaking down exam questions as well. So I've got 6 keywords for you to memorize as a mnemonic for how you're gonna approach each question, okay? Those words are read with diligence, patience before answering. So first, read the question fully. Is there anything that stands out to you about the question? And what exactly is the question asking? Step 2 is what stage of the OT process is this? Is this an intervention? Is it asking about screening, eval, discharge planning? What this is going to do is it allow you to, right off the bat, eliminate some of the answers. So, for example, if the question's asking you about an intervention, your answer is not going to include an OT assessment tool. So if any of the answers include assessment tools, you can go ahead and eliminate them right away. Okay, step 3 is take a look at the diagnosis or disease. So first of all, what is the diagnosis and what do you know about the prognosis of this disease? Step 4 is what's the problem they're looking at in the question. So yes, you know that stroke patients may suffer from aphasia. However, if the question is asking about bilateral coordination or balance issues, you can eliminate any of the questions that have nothing to do with balance issues. Step 5 is to look at the bolded words or any keywords that stick out to you in the question. So we'll go into the keywords that you have to look at a little bit later, but for now, just taking a look at the bolded phrases and keywords that stick out. And the last step is to answer the question. So you want to make sure that whatever answer you're choosing actually answers the root question. So one thing about the exam questions is that some of them might include a bunch of information, and some of that information might actually be unnecessary to answer the question. So it's super important once you pick out your answer based on everything we've already gone through to then go back and make sure that it answers the question that you looked at from step 1. All right, so now I want to go over some of the key words and phrases that you should be looking out for in the questions. So first of all, of course, bolded words and phrases. If there's anything bold in the question, that's where your eyes are drawn to. That should stick out to you. Additionally, there's some words that are going to stick out as red flags. Those are going to be words like always, never, only, all, things like that. It should kind of set off an alert in your brain that it may relate to laws or rules of OT practice. Okay, and finally, some of the keywords, I'm just going to list them here because they have, you'll probably see them in a lot of questions and they definitely have some significance. So I'll list them out, and those are initial, best, first, immediate, most, screening, prevention, at risk, precautions, contraindications, long-term goal, short-term goal, recently diagnosed, pain, and safety. Now some of those words are important because if you see long-term goal and they provide you with short-term goals in the answers, then you know that you can eliminate those. Additionally, you always want to promote safety. So if an answer is something that might not be safe for the patient or is something that may cause the patient pain, those are keys that they're not something that you should choose. Okay. And then major rules of thumb for answering questions are going to be: make sure your answer fits within the stage of the OT process that you're in. Make sure that your answer actually answers the root question. Make sure that you pick an actionable answer. Let's say that you get a question that says that you are transferring a patient to edge of bed and they become lightheaded. Some of the answers that I've come across would say things like lie the patient back down, continue the transfer, or take notes. Answers like take note of the situation are not necessarily actionable steps. So you're not doing something. So taking notes on a situation isn't going to help the patient. So you know that you can eliminate answers that are like that. So making sure that your answer fits into the OT, the stage of the OT process that you're in, actually answers the question, and is an actionable item. One of the last considerations to keep in mind: do not change your answers. Only change your answers if you have an aha moment, because chances are that you were probably right the first time and you're just going to jumble yourself up and get confused. So once you choose an answer, stick with it, unless, say, further on in the exam, you are reading a question and you get a tidbit of information that helps you answer a previous question, then you might go back and change an answer. But other than that, do not change them. One last piece of advice for answering questions during practice exams and during the regular exam is to have a strategy for when you absolutely cannot answer a question. You're going to have questions that you come across that you won't know the answer to, and that you won't even be able to make an educated guess on. Do not panic. It happens to everyone. It happened to me. You will have questions like this. So it's important to have a strategy in mind for when you have those moments, so that you can not panic and you can just answer the question and move on, put it out of your mind. One of the best ways to do this is to actually just have one answer picked in your mind for whenever you come across a question like this, and every time use that same answer. So for example, let's say that you choose the answer C. So you know going into the exam that your strategy is, if you can't make an educated guess and you can't eliminate any of the answers based on your information that you have in the question, just pick C and move on. It's going to save you a lot of time and it's going to make you much more efficient. If you've made it this far in the video, go ahead and leave me a comment below with what your answer is going to be for that strategy during exam day. One thing that I want you to keep in mind is that the NBCOT formulates questions in a way that you have all of the information you need in front of you to answer the question. They're questions that want to make you think, but they're not trying to trick you. So that's just something to keep in mind when you're looking through the answers, because if you feel like you're missing something, you might need to go back, comb through the question again, and you might just find the answer in there. Okay, now I want to go over one example question with you today, because in my next couple videos, I'm going to be going over a bunch of different questions with you. So stay tuned if you're interested to see me break down more questions. Okay, so I have an example NBCOT question here that I'd like to go through as an example for you. On the right hand side, you'll see that I have a little cheat sheet of the strategy for answering the question, as well as the keywords and the considerations we talked about earlier in the video. So I'm going to make that available to you for download, and that'll be available on my blog. Go ahead and take a look in the description below and you'll find a link to my blog page, and you'll be able to just click and download from there. Okay, so we'll go ahead and get started with the question here. So I want to begin by reading through our question and answers. So the question reads, a patient in the early stages of amyotrophic lateral sclerosis, or ALS, presents with weakness in the thenar eminence. During which ADL task would the evaluating OTR most likely observe the effect on function? We've got A, transferring from the bed to the bedside commode, B, taking a sip from a glass of water, C, reaching overhead to don a t-shirt, and D, squeezing toothpaste onto a toothbrush, okay? So now we're gonna look for where are we in the OT process. So as you can see here, we are evaluating the patient. So we're in the evaluation stage. Now what's our diagnosis? Our diagnosis is ALS, okay? And what we know about that is that we're in the early stages of ALS. Those are key things to note so that you can formulate a good idea of what this patient looks like. What is the problem? In reading through the question, we know that the problem the patient has is having some weakness in the thenar eminence. And then finally, are there any bold or keywords that stick out? Well, what I see when reading through this is most likely. That sticks out as a keyword for me. Now, what do we know about the thenar eminence? Well, the thenar eminence is the thick part of the thumb, the base of the thumb, and what it does is helps with small movements of the thumb, including adduction, and it assists in gripping and squeezing of the hand. So, in looking at our answer possibilities, right off the bat, I see a couple that we can kind of disregard. The first is transferring from the bed to the bedside commode. That, for one, says nothing about what type of transfer they're doing, and so we don't even know that we would need the hands. And also, there is no indication in the question at all that the patient struggles with their lower body or any sort of transferring, because they're in the early stages of ALS. So I think we can go ahead and cross that one out. The second one that sticks out to me is reaching overhead to don a t-shirt. In order to reach over your head, you're using muscles of the upper arm and the shoulder. And again, in this question, we're looking at the thenar eminence. So reaching overhead is not going to be a problem. Finally, the last two that I think we can consider are taking a sip from a glass of water and then squeezing toothpaste onto a toothbrush. Both of those are acceptable answers in my opinion, because you do use the thumb and hold it in adduction if you are tipping a glass of water up to your mouth, and you use it to squeeze the tube of toothpaste. However, if we look back into our bolded words, again, we're looking for most likely, and we're also looking for the best answer. So of these two, which answer requires the patient to use specifically the muscles of the thumb and the thenar eminence? The correct answer here is going to be D, squeezing toothpaste onto a toothbrush. They're adducting that thumb to squeeze the tube. So we're going to go ahead and choose D. That'll be our answer. The correct answer is D, and I kind of break it down for you here. So again, ALS progresses distally to proximally. Weakness in the small muscles of the hand is one of the most common symptoms of early stages of ALS. The thenar eminence is responsible for opposition of the thumb. Squeezing a tube of toothpaste requires that thumb opposition. And though holding a glass of water may require static use of the thenar eminence, it does not require the same dynamic force that squeezing a tube of toothpaste requires. Okay, great. So that is how you are going to go ahead and put this strategy to use. This was just a sample today to show you how to put this strategy to use. Go ahead and subscribe to my channel and hit that notification bell to be notified every single time I post. I am planning on making another several videos just going over different questions and stuff like that for the exam. Leave me a comment down below with any questions or suggestions you have if there's anything you're struggling with that you'd like me to cover.